So this is a standard interview question, as we mentioned previously. These can come up in MMI interviews. You just get these standard questions that you would get in standard format interviews. Again, they're to examine your insight into medicine and motivations behind wanting to be a doctor. So we'll go into an example answer. So the question is, what are the qualities of a good doctor? So let's go into an example answer. So I think that there are lots of skills that a doctor needs to be very competent at in order to perform their job well. But I would say that the three most important ones are, firstly, integrity. I think that they get a lot of complex information thrown at them, and quite often there are legal and medico-legal issues that crop up where they are getting conflicting issues that both make sense, but they have to decide what the right course of action is. And within these situations where they are sort of being legally challenged, it can be very difficult to know what the right thing to do is. And if a doctor has a fundamental bedrock of integrity where they are always looking to act in the patient's best interests, but they are upholding the principles of medical ethics generally, then that's a very important skill that they need to have to do their job well. If a doctor doesn't have integrity and doesn't practice medicine in a way that is honest and upfront with their patients, then it's a non-starter and they just aren't going to be very effective at what they do. The second skill that doctors need to have is actually clinical acumen and academic ability. There's a lot of information that doctors need to know in order to perform their jobs well, including different medications, physiology, different body systems, including the cardiovascular, gastroenterology system, the nervous system, the lymphatic system. There is a wide range of information that doctors need to retain and have at their utility as and when they need it. And if a doctor has a high level of academic ability, then they are able to utilize that effectively to get the right diagnosis for the patients that they are looking after. Thirdly, I think communication is one of the three most important skills needed as a doctor. The entirety of the way medicine works is through communication between the patient and the doctor, and between other members of the medical team, between doctors and doctors, between doctors and nurses, and doctors and all members of the multidisciplinary team. So if doctors are poor communicators and they don't get their points across well, and they don't inform their patients of what the plans are and keep them up to date and make sure that they are well informed and well listened to, then the practice and the way that they work, or the way that the doctor works, is going to be very difficult. So communication will make the entire process of working as a doctor a lot smoother, and it will make patients and colleagues feel like things are happening a lot more effectively.